Finding the appropriate provider is critical. It's critical in our ability to manage our symptoms and to be able to really see the success. But I'll also say it takes hard work and it takes time. Don't expect after your first visit you're going to see amazing results and you're going to be cured. Don't even expect after your third or fourth you're going to be cured. But pretty quickly within a couple sessions, you should expect that you're starting to build rapport and that you're starting to understand the purpose of this treatment your provider's talking about, right? Oftentimes when we first go to treatment, it's kind of like, why would I do that? Why would I want to feel uncomfortable? Why would I want to feel anxious? But hopefully pretty quickly you start to see the value in, oh, I get what you're saying. And that makes sense. And what I've been doing for a long time actually has been reinforcing my illness, and you're going to teach me ways to kind of unmesh it and to make it where I don't have these responses that I used to always have. But the big thing is you need to give it some time. That doesn't mean you have to give it a year, right? A lot of people think, oh, therapy takes years or 2 years. No, it doesn't. For OCD treatment in 12 to 16 sessions, you should really start to see a difference. You should start to see and feel comfortable in your ability to manage and understand your symptoms depending on your severity. Now, of course, there's different levels of care. Some of us need more intensive treatment like a residential or inpatient unit, residential support. Some people need intensive outpatient or traditional outpatient. So depending on your severity, you're going to see progress at different time points. But really pretty quickly, you should understand the point of treatment. You should trust your clinician. And then I would say within 12 to 16 sessions, you should at least start to see progress and start to understand how this treatment's going to work for you. Finding an OCD clinician is absolutely critical. I think so many times at the Peace of Mind Foundation, we hear the stories and testimonies of people that it took years and years before they got proper treatment. And a lot of that is because we're not going to specialists, right? We're often going to general mental health clinicians, general counselors who don't specialize in OCD. And so while their intent is to help you and move you forward, at least I hope, right? It may not always be possible for them because they might not have the specialized training. OCD treatment requires an OCD specialist. Your clinician really has to know and understand what exposure and response prevention is and how to apply it so that you can learn to manage your symptoms. Without ERP and without somebody who understands OCD, mental health treatment may not be very effective.